Hello, I'm Vittorio Picardo from Rome. The video you're about to watch is titled New Light on Cavitational Threads. When we perform our cataract surgery, we generally forget which kind of physical and chemical reaction are produced inside the eye of our patient. One of them is a thermal effect, with sometimes some burns of the cornea, and another one is a chemical one, producing free radicals in the aqueous. Using some laboratory examples, the authors of the video, New Light on Cavitational Threads, demonstrate how different phaco tips with specific characteristics work during phacoemulsification. The images are fantastic, as they film sonoluminescence with luminol, which immediately explain the mechanism produced into the aqueous during phaco, when temperature increase and even viscoelastics works as scavenger system, free radicals appears in high quantity. With simple words and animation, they explain the biological effects of Cavitational during phacoemulsification and which kind of damage free radicals can produce on different eye structures, as corneal endothelium. In our practice, in fact, surgeons would like to obtain the minimal ocular tissue stress in the post-op. The key of success are, of course, phaco settings, viscoelastic choice, and tip use with their specific characteristics, as auxil system, ellipse, Kellman design, and some others. The goal of our Japanese colleagues' research is a new special oval tip, which seems to be surgical effective and tissue-saving, especially in the follow-up, with some clinical steps are included to push this idea. And I personally think that is really true. Enjoy!
Free radicals are blamed for all sorts of things, from cancer to cardiac infarction. Add to that corneal damage. PEA ultrasonic oscillation generates strong hydroxyl radicals which can injure endothelial tissue. To understand hydroxyl behavior better, we photographed luminescence. Normally, bursts of light are generated ultrasonically at the tip of the device as cavitations burst, as sonoluminescence. Cavitations are, of course, microbubbles. They're produced by a sudden drop in pressure in a liquid. Pressures and temperatures inside the bubbles rise precipitously when these tiny bubbles collapse. And the molecular bonds in water are broken, radicals of oxygen and hydrogen, hydroxyl radicals generated. Sonoluminescence is hard to photograph, but luminol can be used to generate chemiluminescence, bluish-white 460 nanometer light, produced as the cavitations burst and the hydroxyl radicals are created and spatter. We used a Sony Alpha 7S camera with a super high ISO over 400,000. First, we inserted a phaco tip containing only BSS+. We activated conventional ultrasonic oscillation, but with no irrigation or aspiration. You can see slight luminescence. This could be caused by hydroxyl radicals generated by fluid cavitation, or it could be due to argon gas in the bubbles. Which? We cannot be sure of the mechanism. We added luminol to the BSS Plus and repeated the experiment. You can see bright light above some distance from where the cavitations are formed. We suspect this indicates spattering of hydroxyl radicals. The video is, pardon the pun, illuminating. First, light emission in conventional mode. Next, light emission in torsional mode. The emitted light is less bright, but the area is larger, suggesting that while fewer hydroxyl radicals are generated, spattering covers a wider area. The viscoelastic viscoat soft shell technique is commonly used to protect endothelial tissue from nuclear fragments spattered during PEA. This shell can also be used to absorb free radicals and convert them into stable compounds. To verify the technique, we simulated the anterior chamber of the eye with a viscoat shell up to the red line. We oscillated a Kelman tip in torsional mode. You can see luminol chemiluminescence inside the viscoat shell. We think this indicates interaction between the viscoelastic material and the cavitations. We verified the amount of viscoat eliminated by cavitation, oscillating the Kelman tip with Discovisc in fluorescein-dyed BSS+. Strong water flow and the cavitational shock wave might be one reason for loss of viscoelastic material. But it's also possible that the hyaluronic acid in the substance has bound with hydroxyl radicals and decomposed. To take advantage of such phenomena for safer PEA and less endothelial damage, we have developed a new kind of phaco tip, which is straight but torsional. Its flat distal tip reduces cavitation substantially. Using luminol chemiluminescence, we confirmed low light emission and reduced generation of hydroxyl radicals. Along with protection offered by the viscoat soft shell technique, this new tip promises to greatly reduce the threat of hydroxyl radicals generated by PEA cavitation. It will be ready for practical application soon.